care system. Let's call on our next guest. Kevin McKechnie is the executive director of the Health Savings Accounts Council. Kevin, we appreciate you checking in from Newsmax, New York. And according to the data, it's great to have you with us, Kevin. Thanks a bunch. According to the data, we've seen over 600,000 veterans still waiting a month or longer for VA medical appointments. Why haven't we heard more about this, and how is it that these wait times continue to just seem to draw out there?
Well, good morning, and thanks for having me on. The problem has been addressed the usual way Washington looks at these problems, which is they've rearranged some of the chairs. Some of the more high-profile people have been fired for their mismanagement of the system, but generally the paradigm remains the same, and so we haven't seen the kind of changes yet to the infrastructure that were promised in the legislation that rescued the VA, and it's going to be some time before some of that's implemented.
Why haven't we seen some of those changes?
They're hard. Remember, you're talking about trying to adjust a massive bureaucracy, and I'll give you some idea of scale. We're talking about a system that serves about 6 million veterans, men and women. That's 2 million more than are currently insured by the federal government as the federal government's employees. So it's not small, and you have to remember that it's static and it's full of hard points. It's full of doctors and nurses and hospital facilities. They simply can't change to reflect the new demand after at least 10 years of warfare, and there's been no strategic planning to get them there when we started the war, which is one of the giant failures here that you really can't overcome with new energy.
Kevin, Jeff Miller, the chairman of the House Veterans Affairs Committee, had something to say about the crisis of the VA. Let's take a listen and get your reaction.
The events of the last year have proven that far too many senior VA leaders have lied, manipulated data, or simply failed to do the job for which they were hired. It's also clear that VA's attempt to instill accountability for these leaders has been both nearly non-existent and rife with self-inflicted roadblocks to the reform that each of us expects.
Do you agree with Chairman Miller that the VA continues to face a systemic problem?
I do, and those data have not been opposed by either party. It's now well known, and that was in fact one of the reforms that was put in. These waiting time lists were the incentive for bonus pay, and that system was wisely scrapped by incoming Secretary McDonald.
Kevin, let's talk about Bob McDonald. He's been on the job now for 3 months. How would you rate his performance?
I think he's doing very well. First of all, he realized that you need to change the paradigm, and so the necessary work of changing the personnel most responsible, notably this problem in Phoenix, this has already happened. And so he's making the kind of changes that are available to be made before he takes the next leap of faith, which is what we really wanted to help him with. I think there's been enough beating on the secretary because we're getting to diminishing returns as far as the criticism goes. Now it's time for people to come forward with genuine solutions. We think we've got one, and so that's what we want to do for the secretary.
Kevin McKechnie, only about 30 seconds remain. We want to have you back to talk not only about veterans health care, but also health savings accounts, something I worked on during my days in the Congress. For now, please, sir, accept our thanks for your time today, joining us from Newsmax, New York. Health savings accounts, very important. Hey, coming up in just a minute, a guy who was also on that Ways and Means Committee with me, Kevin Brady. He's got a new way to survey average working families and what they face. That report and details coming up when we continue on America's Forum.